Okay, great. So, not sure where we're at. Hopefully the slide is projected, and we
It
will
is.
go ahead and great. We'll move right on then. So, taking a look at the slide that we've all come to know over many, many weeks, our cases and testing, we continue to see a fairly significant upward rise in both testing and cases. If you notice the ratio between the blue line, the number of cases smoothed over 14 days, and the orange bars, the number of tests smoothed over 7 days, continues to remain relatively consistent from period to period, while both are in an upward swing. And we'll see what that means to us in this slide, and that is that our positivity percentage continues to increase. We're back to a little bit above 25% positivity, or 1 in 4 tests being conducted coming back positive when considering both the antigen as well as, the rapid antigen testing as well as RT-PCR testing. Our hospitals continue to show small increases week over week in the number of hospitalized patients. One thing that we were able to confirm on a meeting earlier this week with our healthcare advisory panel is that all of those individuals who are hospitalized with COVID at both of the Berks County facilities now are individuals who were not inoculated at the time of their admission. So it continues to support the assertion that the likelihood of reducing an infection to something less than serious illness requiring hospitalization with vaccination continues to be a strong argument. Great news, as always. Well, I shouldn't say as always. Great news, as has been the case in recent weeks. Our deaths are extremely flat. We had been averaging approximately 1 fatality per week, and I think that in the last 12 days or so, we've actually had 0 fatalities. So we like to see that very flat line there for our COVID deaths. Vaccination information, somewhat unchanged. We remain 9th in the state, not surprising given our population. We've had no change in our per capita rankings for fully vaccinated, and we've actually dropped down 1 position with respect to our at least 1 dose numbers. So we've looked at these thermometers now for a number of weeks. We see that Pennsylvania is at about 64.5% of their 70% over the age of 18 goal, and Berks County is at about 60% of that goal. And we've talked about this slide repetitively also, and this is if everybody who started would finish, where we would be at. And the good news is that we would be at about 71.1% over the age of 18 vaccinated if everybody who had their first dose would finish it up. We have a little problem, though, that is being noted, and we've talked about this kind of at a high level over a number of weeks. This is the first time that we've really shown the math or the numbers behind it. So if we go back a month to July 22nd, 4 weeks ago, we had a delta between our fully vaccinated and at least 1 dose of 35,181 people. So said very simply, there were 35,181 people who were in process but not yet fully vaccinated. And because depending on whether you're getting Moderna or Pfizer, it's a 3 or 4 week course, we would expect that after 4 weeks, those 35,181 people should have been moved into the fully vaccinated column, assuming all of them got their second dose, which we're never expecting 100%. But the problem we run into is that when we take a look at the data 4 weeks later, today, August 19th, we don't see that. In fact, what we see is that a little under 10,000 people have moved to fully vaccinated, not the 35,200 we would have expected. And at that same time, our at least 1 dose has gone up by a little over 11,500 and are in process by about 2,300. So to make it very simple, we assume that none of the newly vaccinated in the last 4 weeks were single shot Janssen, and of course we know that's not the case, but it makes the math easier. What we see is that there's a growing hole of about 26,000 partially vaccinated people in Berks County, and because we cheated on the Janssen evaluation, what we know is that number is actually higher. And what that really means is that if we back those out and we assume that those folks are not going to finish their vaccination cycle, we're really somewhere around 63.2% of our 18 plus population who is on track to be fully vaccinated. So we're not clear, of course, in every case why folks are not getting their second dose, and we're not physicians. The only thing we would encourage folks is that if they've made a decision to get the first dose of an mRNA vaccine and independently made the decision not to go back for the second dose, we would really encourage them to talk to their healthcare professional about that and come to a determination with some advice from a healthcare professional whether that's a good move or not. And one last slide I want to show here is just kind of how we're stacking up against Pennsylvania as a whole by percentage. And what this shows is the growth in each age category since May 26th. And in the left-hand column is how Pennsylvania grew, and in the right-hand column is how Berks County grew. And I've circled in red or green each of the breakpoints for age. And what we can see is that we in Berks County, in comparison to the rest of the state, are doing a pretty good job. We've grown since May 26th at a rate higher than the state on average in every category, with the exception of the 12 to 18-year-old category. There we are lagging behind the average growth in the state. But you know, I guess I'm trying to mix the message up a little bit here and say that we haven't necessarily met all the goals that we're hoping to meet, but I do think we in Berks County, getting back to our message of do your part, are doing a pretty good job of doing our part. So that's all that I have, Commissioner, other than to, of course, remind everybody about doyourpartberks.com, where they can find information about vaccine providers, as well as the ability to go to your local pharmacies or your healthcare professional if you'd like to pursue vaccine. And with that, Commissioner, I will pause and see if there are any questions.